Hi there and welcome back to Dr. C's Morning Minute. Glad you could be here. So answering questions from you, the parents, and I always, as I said, welcome those questions at jcarasso@cpcwecare.com. Really welcome those questions, having an opportunity to answer them directly. So Beth from Mount Washington writes, is ADHD and autism on the same continuum? This is a very common question, very common notion that some disorders, many disorders for that matter, have very similar core features and by and large, in one respect or another, are on the same continuum, one evolving into the other and vice versa. So let's look at it this way. There are many similarities between diagnoses and overlapping symptoms. ADHD and autism, as an example, OCD and autism, looking at major depressive disorder and anxiety disorders, lots of overlap. It'd be quite rare, well, I shouldn't say that. Not uncommonly, individuals who've been diagnosed with autism will have attention problems and sometimes even diagnosed with ADHD. Kids with ADHD may very well have some issues socially, little quirks here and there that may seem a little spectrumy in that respect. It'd be hard-pressed to find an individual struggling with major depressive disorder who's been diagnosed in that respect who doesn't have really pronounced issues with anxiety. And again, it's not uncommon. People who struggle with anxiety may get depressed at times. However, in terms of the core features and symptomology that lead to a diagnosis and lead to seeking treatment in the first place, the core symptomology is frankly quite different. And that really is the key, is that the core symptomology is notably distinct and different from one another, especially when it comes to ADHD and autism. Two really different diagnoses, different conditions, overlapping symptoms at times, and at times we may diagnose both, at times not so much. And I've spoken on this in other posts and written about it as well. You can check them out about how we make those distinctions. But really, largely, they can be seen as different and distinct. Of course, you get different opinions on this, of course. But again, I think you'll find that when we talk about the core symptomology, they are quite different and can be diagnosed distinctly as a result. Hope that helps to answer the question. See you next time, Dr. C's Morning Minute.